Okay, so this is going to be the presentation on public health nursing, specifically in Pinellas County. And this was developed by Shelley Personette, who worked for Pinellas County, and I'm not so sure she works there anymore. And I adapted it last spring. Okay, so we're going to talk about the history of public health nursing. Lillian Wald was the first public health nurse, and she began her career in 1893. And she's actually viewed as the founder of public health nursing. She was a nurse who lived in New York City in the late 1800s and started with the home visits to help provide care for impoverished immigrants. Public health nursing is the practice of promoting and protecting the health of populations using knowledge from nursing, social sciences, and public health sciences. Public health is different from clinical nursing because the focus shifts from the individual to the population. Public health nurses work with individuals, but their bigger focus is on the community. The goal of the public health nurse is to combine public health core functions with nursing practice to achieve health goals for a population. There are 8 principles in public health nursing, and they form the foundation of the public health nursing. These principles were first established by the American Nurses Association. The first principle is that public health nursing focuses on populations. The patient is not one person, but the whole community. The second principle is that the goal of public health nursing is to do the greatest good for the whole population. Sometimes to do this, we have to make decisions that impact individuals. For example, public health agencies may have to quarantine individuals in order to protect the entire community. Another key principle is that clients are treated as equals. A fourth principle is that primary prevention is the priority. This can be viewed as health promotion, preventing unhealthy behaviors and promoting healthy alternatives. Continuing with the 8 principles of public health nursing, public health nurses work to create healthy environmental, social, and economic conditions. Their focus is on those at the highest risk and to use available resources and develop collaborations to promote and protect health. So, public health in the United States evolved primarily from programs that were developed in Western Europe, particularly Great Britain. In the early 1860s, trained nursing school graduates were assigned as visiting nurses to provide care for the poor in their homes. They were called district nurses. And although they provided nursing care for the sick poor, they did not provide direct care to persons with communicable diseases. To avoid disease transmission from one household to another, these nurses provided care indirectly by teaching family members how to perform tasks and providing the family with necessary equipment. So guess what we're going to talk about now? The dreaded nursing process. The practice of public health nursing is carried out through 6 activities: assessment, diagnosis, outcome identification, planning, intervention, and evaluation. Just like in clinical nursing, you follow a set of steps that lead you through assessment, diagnosis, planning, etc. In public health nursing, you go through the same steps on a population level. And you do this by looking at data. You're able to assess the community and make a nursing diagnosis. You determine a problem and you identify an outcome. Then you carry out interventions to address the problem and finally evaluate the results of your interventions. So let's really talk in depth about assessment. An RN uses a systematic, dynamic way to collect and analyze data about a client. The first step in delivering nursing care. Assessment includes not only physiological data, but also psychological, sociocultural, spiritual, economic, and lifestyle factors as well. For example, a nurse's assessment of a hospitalized patient in pain includes not only the physical causes and manifestations of pain, but the patient's response. An inability to get out of bed, refusal to eat, withdrawal from family members, anger directed at hospital staff, fear, or request for more medication is part of the assessment. The public health nurse assesses the health status of populations using data, community resources, identification, input from the population, and professional judgment. When diagnosing, the public health nurse analyzes collected assessment data and partners with people to attach meaning to those data and determine opportunities and needs. Outcome identification is used to provide and supervise and expedite a client's healthcare services. You want to be providing appropriate resources. The public health nurse participates with other community partners to identify expected outcomes in the population and their health status. With regards to planning, they're going to establish priorities, set goals, choose nursing interventions, and identify resources within the community. During intervention, they will implement the plan, use professional and research-based nursing actions. The public health nurse promotes and supports the development of programs, policies, and services that provide interventions and improve the health status of populations. During evaluation, they're going to measure the accuracy of the nursing diagnosis, determine appropriateness of the nursing interventions, achieve the mutual goals of the client and family, contribute to program and service delivery evaluation, and promote professional competency. So here again, the public health nurse is evaluating the health status of the population. So what is the role of the public health nurse in the nursing process in epidemiology? Well, they're going to find out the who of whom and the what and why. Why are those who of whom can't have, what do not? Is the command of those of whom must care and do enough to fund the men who find the who, which have the what and the why and how? By defining the what, counting the who of whom, we do not have what, and for what reasons why, in order to protect the who of whom who don't have what from those who do, and also from the what who has, or from reasons why. Just know that this is difficult to understand, and it's just a poem that was developed by Marcy Connell, who was a member of the San Francisco Bay Health Association. So let's talk a little bit about the standards of care in epidemiology and how the public health nurse provides this care. They're responsible for all the surveillance, whether it be passive or active. They conduct special studies and surveys, they identify contacts, and they collaborate with others. They collect data. They confirm illness with the physician, determine susceptible contacts, and identify other health problems. They determine epidemiologic status. They determine nursing diagnosis. An example of a nursing diagnosis for a salmonella case would be diarrhea or risk for volume deficit. Is it a case? Using Florida case definitions. Inform the physician in selected situations. Okay, so let's talk about planning. What are you going to do about it? Well, you're going to plan, you're going to have interventions, and you're going to have continual evaluation. You're going to gather info in lab testing. You're going to use control measures, nursing interventions for other identified healthcare needs if you find them, need of other resources, refer to other providers as necessary, and evaluate expected outcomes. You want to obtain information and testing as necessary as well. Institute control measures so that nobody else becomes ill. Provide nursing care as appropriate for other healthcare needs. Collaborate with and refer to other healthcare professionals and resources as necessary. Then you want to go back and evaluate. Did you cover everything? Did the client understand? Were mutual goals reached? Did you document it? And there are resources that you can find, what is reportable, what is not reportable, to report specific disease outbreaks. Merlin is another reporting system. Monthly EpiWatch, you can find in Pinellas County Health Department. Liaisons with private healthcare providers. I mean, reporting has a number of different meanings, and so it'll be done when it needs to be done. And you can find this information, what needs and what needs to not be reported, on specific websites. These are some of the investigative settings that are used in community health. And you might see a public health nurse gathering data in these settings. If there would be any outbreak of the above, the public health nurses would be in the prime role to investigate any of these issues. Another thing we can add to this is multi-drug resistant organisms. I know I mentioned multi-drug resistant organisms in the prior slide, and often they're not reportable as yet, unless they're seen in clusters. They're becoming more prominent in all settings, and mostly hospitals and long-term care facilities, although there are some that are coming out to the community. The public health nurse needs to become aware of these and the precautions necessary to protect patients and ourselves, like Pseudomonas, E. coli, diseases that affect the CNS, amoebic encephalitis, Creutzfeldt-Jakob disease. I don't know if any of you are aware of that, but that's mad cow disease, and meningococcal diseases as well. Now, the public health nurses certainly needs to be knowing some of these diseases. So what is the role of the nurse in public health for disaster preparation? Well, they'll prepare themselves and their family, as well as your family, learn the duties and responsibilities, team with others that monitor illness after the disaster, activated after the disaster to assess the community and to investigate outbreaks. There are some teams and partnerships that they'll partner with, like strike teams and disaster community health assessment teams, and they're in a prime role to help after the disaster and during the disaster as well. Now we're going to talk about the 10 essential public health services that should be done in every community. These were created as a guideline for public health departments. The Core Public Health Functions Steering Committee developed the framework for essential services in 1994. These specific services are called the 10 essential services of public health. These 10 essential services are activities that should be carried out in every community. They were developed to guide the activities of the public health department. So, monitor health status, and they're going to do this to identify and solve community health problems, such as car seat safety inspections and checkpoints, cholesterol screening, cancer screening. Those all fall under monitoring health status. Diagnose and investigate health problems and health hazards in the community. They're going to be monitoring teen pregnancy, childhood immunization rates, obesity trends, outbreak investigation. These essential services conduct needs assessments by collecting data and analyzing the data. The public health nurse is also there to inform, educate, and empower people about health issues, such as the Great American Smoke Out and health fairs or community events. They will be mobilizing community partnerships and action to identify and solve health problems. So they might partner with the American Heart Association, and they might partner to help with the tobacco grant in the CDC department. As we continue the 10 essential public health services, they're going to enforce the laws and regulations. Any laws and regulations that have been developed within the community, they will certainly help enforce those laws. They're going to use their resources to link people to the needed personal health services that they need, especially the underserved population. Also, one of the essential public health services is they're able to ensure competent healthcare workforces. So this is about educating the public health nurse and anybody that works for the public health department. And then they're also involved in research with the data collection, research, and outbreaks. The 10 greatest achievements of public health in the 20th century. Immunizations, obviously we know how much that has helped. Motor vehicle safety, the use of car seats for infants and safety belts, workplace safety with OSHA, and how we care for our workforce, control of infectious diseases, the use of antibiotics. The public health nurse was instrumental in declines in the death from heart disease and stroke. Continuing with the greatest achievements, safer and healthier foods. There's certainly in place for the CDC to actually look into a salmonella outbreak, that type thing. Healthier mothers and babies, infant mortality has decreased in our country. Family planning, fluoridation of the drinking water. I know that in Pinellas County that stopped due to financial concerns, and then the dentists were up in arms. Them, in conjunction with the public health nurses, got fluoride back in the water. And the big emphasis on tobacco as a health hazard. And here's a list of some websites that, especially for you guys that are doing your assessment, that you can go on and find out some information with regards to data and what's going on in your community.